Age is a very, everyone goes through age, young age, 20s, 30s, 40s, you know. But as a woman, and by the way, I will not leave men out as well, because all this discussion is, you know, they still have to be, continue to grow. Unaingia ile age yenye, first of all, unaingia kale ka preteen, then you get, adolescence is like a stage in life, so which involves preteen and teen, So that stage in life is called adolescent, and then you get into reproductive age group, and then post-reproduction. When you start your menstrual period, it means you're automatically fertile. Just when you start your period. And by the way, there are people who, before they even start their period, just before you get your period, you have to ovulate, right? So when you're closer to getting your period, it means you can still get pregnant. Because you've heard of cases where people have had a pregnancy before they even got their first menstruation, How did that happen? So people need to know that, yes, menstruation is the onset of like clear indication that you're fertile and you can conceive anytime. But just the period before the period, there's usually an ovulation and then a menstruation. But as you continue to grow, you become even more fertile in your 20s. And this is now the reproductive age group, you know. So we start, in fact, reproductive age group starts from 15 all the way to 49. All over in the world, So 15 to 49 is that age where, you know, you can get pregnant, you have your menstrual period, you're starting to learn your cycle, you know, your cycle is 28 days and all that. This is the moment where most of us will get our babies, will grow our families, and then there's that after 49. So after 49, most women have gone into posity. And then something else that you need to know, even if you're getting into menopause, that 1 year you're transforming, you can still get pregnant. There has to be, like, there's usually some irregular periods. They start to become irregular. So when they're irregular, there are times that you could be ovulating, but you don't know that you're ovulating. So you still have to be very careful between that age of above, let me say, about, because these days, sometimes people get into it early, 38, all the way to 49, you can still get pregnant.
Oh, wow.
Yeah, it's more difficult, but you can still get pregnant. So I think people just need to know, as long as you're in your preteen, all the way to almost post-menopause, that time you can get pregnant anytime. Actually, there's hormonal, non-hormonal. This is when we intervene as doctors. But I'll start with the natural method because I think that's the easiest. You can do it at home. You can decide when to do it, when not to do it. But disclaimer, they can be very, very faulty. And that's why sometimes you need us to help you choose one thing that will help you. You don't have to think about it. You don't have to plan it, you know. Because what happens is that when you do natural methods, sometimes you can either miss a day, withdrawal, they are just not able to withdraw that day. Then you end up still using emergency pill and the rest. So natural methods are very, they're actually not very many, but when you divide them into what you can use as a woman, and then there's that one that men can do. So for you as a woman, you have a cycle, and the cycle is your telltale sign that I am fertile. Most of the time, if you have any other issue, you'll probably have periods of no period. Like, it's called amenorrhea. So you don't have periods for 6 months and what. You cannot use that. You cannot use natural methods in terms of counting your days. So one of them is counting your days, like a regular 28-day cycle. That one is very, very good because 28 cycle, you know, day one of your period is your day one. Like number one. Then you count 2, 3, 4, 5. So until the next period, the next period starts on day either 29 or day 28. So you start again day one. So these people, if you do have such a cycle, that's 28, 29, 30 days, or even 27 days, you should know that your ovulation is going to be right in the middle of that 28. And that's around day 14. Ovulation day does not mean that's the only day that you can get pregnant. It's just an estimate, You know, God just created our bodies to do whatever it wants when it wants. So your fertile period is usually between, I'll put a big wide angle because there are people who have 25 days, 28 days, you know, from day 10. Anytime from day 10, all the days until day 16, 17, you're likely to get pregnant. For most people with regular periods. So I've not just given for 28-day cycle, but even those are 35 days, the ones with lesser days, from day 10 all the way to day 17, most of us will be fertile. Okay? So it's good to know. That's the time I'm fertile. I need to either, number one, abstain, because that is a natural method. Actually, abstinence is a natural method. And then, or you can actually do the withdrawal at this point. When you're ovulating, the discharge becomes clear. And it is pullable.
Yes.
Very pullable.
Yes,
so there are people who know this is the time I'm ovulating. But again, it's not very obvious. Nobody should lie to you that you don't have discharge. Yeah. Discharge is important. It helps you maintain your normalcy. It maintains, the bacteria inside there, the good bacteria. Yeah. It prevents smell and then prevents friction. Yeah, because friction will cause itchiness, and that's things that happen in menopause. Yeah, because most of the time they don't have estrogen, so you develop problems because you're drier. But kuna wale pia wata get pregnant even during their period, because there are people who actually have intercourse during period, so they will get pregnant during that time. But it's because of that irregular. Maybe they have irregular periods, or at some point you're just ovulating, or maybe you've changed environment. You cannot predict. Kabisa. Yeah, so if you do have a 28-day cycle or any other cycle, but it's regular, you can count day 10 to day 17. Lazima uji protect somehow. Yeah. Yes. So that is the natural. For men now, they can use the withdrawal method. It's a natural, way of preventing pregnancy. Yeah. But now there's also this group of people who are called post-delivery pregnant women who have just delivered. Yeah. So when you've just delivered, breastfeeding, by the way, is a natural method that I forgot to mention. And it's very, it's very effective. There's a criteria you have to fulfill before we say that you can be fully left on just breastfeeding. Okay. Yeah? You must breastfeed exclusively. Like, hakuna kitu ingine unapatia mtoto. Mtoto ako na wewe ana breastfeed every 2 to 3 hours. Yeah. See, our women by 2 months, they go back to work on the 3rd month. That breaks the thing, yeah? Okay. That's one of the things. Secondly, your period should not have come back. Because remember, a period is equal to is most likely an ovulation that happened. Yes. So if your period comes, it means then you're now fertile. But if you're exclusively breastfeeding 2 to 3 hours every day, your period has not come back, then it's possible to actually keep breastfeeding. Okay, and you don't just a bit on the menstrual, how the cycle happens, is that for you to have a normal period, you have to have developed the inside layer, which is called endometrium. And it's the one that breaks down and becomes a period. At the end, when you're starting your period on day 1, that thing just pours out, okay? And the purpose of pouring out is because it did not receive a baby to remain there. Then, that's your day 1. So remember, it was your day 1. Yes. Once you menstruate, then your ovaries, there's hormones, your brain knows there was no baby. So it produces some other hormones that go down to your ovary, and then your ovary select eggs, and the biggest egg is one that will ovulate. So every month you select several eggs, and this is where our eggs end at some point. You don't just, when you ovulate one, you did not just pick only one egg. Your body picked several, but only the winner really ovulate. So that's how our eggs, we were born with 500,000, a lot. But they end, and it's good that they end. So one egg will be produced. As that egg, before it's produced, it produces some hormones, progesterone and estrogen. Now, those hormones are the ones that make the uterus produce the endometrium again. So when the egg is coming, it's telling the uterus, produce endometrium. So that's why we use estrogen and progesterone. That's the background as to why we use estrogen and progesterone. Exactly. So for us, what we want to do is to stop your fertility for a moment. Not forever, but for a moment. Yes. And for us to do that is either we stop you from ovulating, okay? And how do we do that? We add you progesterone and estrogen, which are, when they are on high levels, your body says, there's too much level of this, it stops the progress of ovulation. Your body has a very interesting way how it works. When something is in overload, it says, stop whatever you're doing. Yeah. So now when we add estrogen and progesterone, which is already in your body, it stops ovulation. Okay? Then, yes, that's one way. Yeah. The other thing is to also reduce the movement of that the fallopian tubes. They usually, like peristalsis, do that to reduce the movement of that peristalsis so that you don't get a fertilization. And the other way is to either increase the mucus of the cervix so that the sperms don't really get up there. Okay? So those are different ways that all these hormones work. Okay? So now this that's the background as to why we use estrogen and progesterone. Yes. So now from there you can know there's pills. And these are the daily pills people take every day. Yeah. And for what reason? To go and heighten the estrogen and progesterone to reduce, to stop you from ovulating. Yeah. Then secondly, you can use progesterone only. Estrogen on its own cannot be used alone. So don't use estrogen alone for any reason except when the doctor writes it for you for a particular reason, yeah? Because estrogen is very good, yeah? The only thing is that if you use it alone, you're at risk of getting clots, you're at risk of getting what? So progesterone comes to cover up. Yeah, so you can use estrogen and progesterone. That's the combined oral contraception, daily pill. Then there's the progesterone only, which also goes to prevent ovulation, but not as strong as estrogen and progesterone. And then now we have the other ways we put the hormones, either through the implant. The implant is just progesterone. And then now we have the injectable, the depot, which is also progesterone alone to prevent ovulation. So now kama mtu mwenye amefanywa hiyo estrogen and progesterone, estrogen has a tendency of making someone develop clots on its own without progesterone, yeah? So you can develop clots and what. So if you're a person who is at risk of developing clots, for example, you have heart disease, hypertension, we prefer if you don't use the estrogen and progesterone. Yeah, people who are already bigger, because the estrogen, what it does, it keeps fluid and fat. Estrogen is what makes you have hips and kuna wale sasa now the first few months they will add some weight and then it will reduce, because there's also water weight that is picked up when you use estrogen and progesterone. So if you're already overweight, then we don't recommend that you use estrogen and progesterone together. Yeah, and if you have clotting problems, don't use estrogen and progesterone. So you can use depot, yes, after delivery. You can use an implant. You can use also the daily pill, which is only progesterone, not estrogen. Don't use estrogen when you're breastfeeding to cut your milk. Yeah, so those are options that you can use. There's another one that has estrogen and progesterone. It's called a patch. It's just a patch, like the way you use cigarette patch. That one. So no, it contains estrogen and progesterone. So what you need to do is place it. Usually we place it at the back. You can change positions every week. So you put one on Monday. You can shower with it, whatever. You can swim with it. Then the third week you put it in another place. Yeah. So you have 3 months. 3 weeks of patch and 1 week free of patch. Yeah, that one you have your period during that time. Yeah, so that's another contraception that has both estrogen and progesterone. Again, it does what? It goes to prevent ovulation. Yeah. So emergency pill contains high dose progesterone only. High dose, very high dose. Like you cannot use it every day. Yeah. So you only use it once. And only use it particular times if there was rape, if the condom burst, if you are using a condom, or for one reason or another, you are close to your ovulation and you will get pregnant. Things happen. You can use it. But we don't like you using every single day, because they are all working together, estrogen, progesterone. So if you use too high dose, the other one will disrupt your cycle in a way that now you cannot control whether you ovulated. And there are people, when they use too much, then their calendar completely distorts in a way that we have to restart with other hormones. So those are the main hormonal ones. There's a coil also that contains hormone. Progesterone, again, remember progesterone is more protective in this view. So the coil that has the progesterone, we insert it inside the uterus and it just releases the progesterone inside the uterus. It doesn't go into the system. Very kidogo can go through. Very good for people who are bleeding a lot. Like you have too much, your periods are heavy. We use those products that contain the progesterone IUD. It's very good for people with adenomyosis, endometriosis. We go to the permanent. Permanent is when you're done. I'm done getting kids. I don't need to have this discussion anymore. So the female can decide, I'm going to do the bilateral tubal ligation. I think most people call it the TL.
We call it the TL, yes.
Yes, and because there are two, we have say bilateral tubal ligation. So what we do is that those tubes, we go and close them. We close them, Either we clip them or we cut them, whichever the way, we just block. But the men, it's easier, even vasectomy. Yeah, it's a very good option, especially if you don't want your wife to go through another contraception. Imagine she's tried all these things and then you don't want to even try at all, you know, and you know, even you're done with getting kids. I think there's only one story we've seen where some gentleman got a baby after the vasectomy. And it's important to note that, you know, men have a long tube. Inside there's sperm that's just being made every single day. Every, like, even right now, they are forming sperm. They're basically just forming sperm. So that production, you have like millions and millions and millions inside the testicle, right? So when we go and close, you see, no, this is the testes, and then it goes upwards towards now, so that it can connect to the urethra. That tube is the one that we close.